Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating piece of research published in the Journal of Veterinary Internal Medicine in 2024. This study, conducted by Ashley Melko and colleagues at the University of Wisconsin-Madison and Texas A&M University, investigates a common question in veterinary practice. Does feeding a dog affect the accuracy of blood tests used to diagnose gastrointestinal and pancreatic diseases? Specifically, the researchers looked at the serum concentrations of four important markers: Cobalamin, also known as vitamin B12, folate, canine pancreatic lipase immunoreactivity, often referred to as cPLI, and canine trypsin-like immunoreactivity, or cTLI. These tests are routinely used to help diagnose and monitor conditions affecting the small intestine and the pancreas in dogs. Current guidelines often recommend withholding food from a dog for 12 hours or overnight before collecting a blood sample for these measurements. This recommendation historically stemmed from older testing methods, particularly radioimmunoassay used for cTLI, where fat in the blood, known as lipemia, could interfere with the results. However, the methods used today for measuring cobalamin, folate, and cTLI primarily rely on chemiluminescence assays, and cPLI is typically measured using an ELISA. These newer techniques are generally less susceptible to lipemia interference. Withholding food can present several challenges. It might be perceived as reducing the well-being of the dog, create logistical difficulties for both pet owners and veterinarians, and in acutely ill hospitalized dogs, it can delay the resumption of feeding, which is often beneficial. Interestingly, studies in humans have found no clinically significant differences in serum cobalamin levels with varying fasting times, and folate concentrations don't significantly increase after eating. Similarly, research in healthy dogs suggested that withholding food had no clinically relevant impact on the serum concentrations of these four analytes. However, a crucial gap in our knowledge remained. How does feeding affect these measurements in dogs that are already showing signs of chronic gastrointestinal disease, the very population in which these tests are most frequently used? Therefore, the primary goal of this study was to determine if the serum concentrations of cobalamin, folate, cPLI, and cTLI obtained 2, 4, and 8 hours after a meal would be comparable to the values obtained after a 12-hour fast in dogs with ongoing gastrointestinal issues. A secondary objective was to assess whether any observed changes due to feeding would alter the clinical interpretation of these test results. The researchers hypothesized that post-meal measurements would be equivalent to fasted values and would not lead to different clinical interpretations. To answer these questions, the researchers conducted a prospective clinical trial involving 51 client-owned dogs diagnosed with chronic gastrointestinal disease. These dogs had experienced signs such as vomiting, diarrhea, poor appetite, or unexplained weight loss for more than 14 days. The participating dogs were adult, medium to large breeds, consuming a balanced diet, and were willing to eat in the clinic and undergo repeated blood draws. Dogs with severe anemia, dehydration, blood clotting disorders, conditions where fasting could be problematic like diabetes, or those who had received cobalamin or folate supplements in the previous month were excluded from the study. After an initial blood sample was collected following an 11 to 13-hour fast, considered the baseline measurement, the dogs were fed their regular food, or a standardized gastrointestinal diet, if they were not interested in their own food. To continue in the study, the dogs needed to consume at least 50% of their calculated resting energy requirement within the hospital. Subsequent blood samples were collected at 2, 4, and 8 hours after feeding. The dogs had access to water but no further food during this sampling period. The collected blood samples were carefully processed to obtain serum, protected from light, and frozen before being shipped to the gastrointestinal laboratory at Texas A&M University for analysis. The stability of these analytes in frozen serum for extended periods has been previously established. The laboratory analysis involved commercially available automated chemiluminescence assays for cobalamin, folate, and cTLI, and a commercial ELISA for cPLI. The clinical interpretation of the test results was based on the laboratory's established reference ranges. For statistical analysis, the researchers used equivalence testing to compare the post-feeding measurements with the baseline fasted values, considering predefined margins of acceptable difference for each analyte. Now, let's move on to the findings of this important study. Regarding cobalamin, the average concentration in the fasted samples was 517 nanograms per liter. The study found that the mean cobalamin concentrations at 2 and 4 hours after feeding were statistically equivalent to the baseline fasted values. However, by 8 hours post-feeding, the cobalamin levels were no longer considered equivalent to the fasted levels. Interestingly, while the average cobalamin levels at 2 and 4 hours were equivalent to the fasted levels, the clinical interpretation of cobalamin status changed in a notable proportion of dogs, specifically 27%. In most of these cases, a normal fasted cobalamin level was followed by a borderline low or gray zone level after feeding or vice versa. This change in interpretation could have led to different recommendations regarding cobalamin supplementation. Turning to folate, the mean fasted concentration was 13.7 micrograms per liter, falling within the normal range. Similar to cobalamin, the average folate concentration at 2 hours post-feeding was found to be statistically equivalent to the fasted value. However, by 4 and 8 hours after eating, the folate concentrations were no longer equivalent to the baseline. In a significant number of dogs, 35%, the clinical interpretation of folate levels differed after feeding compared to the fasted results. These fluctuations often involve changes between low, normal, and high folate concentrations, which could potentially influence decisions about further diagnostic testing. For canine trypsin-like immunoreactivity, or cTLI, the mean fasted concentration was 31.1 micrograms per liter, also within the normal range. The study showed that the average cTLI concentrations at both 2 and 4 hours after feeding were statistically equivalent to the fasted levels. However, at 8 hours, equivalence was not established. In 20% of the dogs, the clinical interpretation of cTLI concentrations changed after feeding, with levels fluctuating between the normal and high ranges. Importantly, none of these changes resulted in a shift below the lower limit of the normal reference range. Finally, the researchers examined canine pancreatic lipase immunoreactivity, or cPLI. Due to a large number of results falling below the assay's limit of detection, it was not possible to statistically assess equivalence for cPLI. However, in the majority of dogs, 88%, the clinical interpretation of cPLI concentrations remained the same across all post-feeding time points compared to the fasted values. In the small percentage of dogs where the interpretation did change, the values typically fluctuated between the normal, borderline, and high categories. Now, let's discuss the implications of these findings. The study's results suggest that while for cobalamin and cTLI, measurements taken 2 and 4 hours after feeding are on average statistically equivalent to fasted values, and folate is equivalent at 2 hours, a substantial number of individual dogs experience changes in the clinical interpretation of these analytes after eating. This was particularly true for cobalamin and folate. The observation that postprandial cobalamin concentrations were generally lower than fasted values in this study, unlike findings with high-dose oral supplementation, likely reflects the physiological doses of cobalamin present in regular dog food. The fluctuations seen in cobalamin and folate levels after feeding could be due to various factors, including subtle differences in how these vitamins are processed by the body, normal variations in the assays themselves, or potentially altered nutrient absorption related to delayed stomach emptying in dogs with gastrointestinal disease. Stress from being in a hospital setting could also contribute to delayed gastric emptying. Interestingly, studies in humans have shown that cobalamin and its binding proteins can vary within a 24-hour period, seemingly independent of meals. While current recommendations for cobalamin supplementation may not always strictly differentiate between borderline low and frankly low levels, the fact that feeding altered the clinical interpretation, potentially affecting supplementation recommendations in 12 out of 14 dogs with changes, is noteworthy. Similarly, while shifts between normal and high folate might not drastically change immediate treatment, changes between normal and low folate in a significant number of dogs could influence decisions about further diagnostic procedures. The finding that cTLI levels were equivalent to fasted values at 2 and 4 hours post-feeding contrasts with some earlier research in healthy dogs that observed a slight increase in cTLI after eating. The higher fasted cTLI levels observed in this study might be related to the population of dogs with gastrointestinal disease. Although some individual dogs showed changes in cTLI interpretation after feeding, none of these fell into the low range indicative of exocrine pancreatic insufficiency. Given that cTLI is less specific for pancreatitis than cPLI, these fluctuations are unlikely to significantly alter the clinical management of most dogs, particularly when exocrine pancreatic insufficiency is not the primary concern. For cPLI, the inability to establish statistical equivalence was a limitation, but the majority of dogs did not show changes in clinical interpretation after feeding. The variability seen in individual dogs could be attributed to natural circadian rhythms in lipase activity. The decrease in cPLI levels over time in some dogs after feeding aligns with its relatively short half-life. It is important to remember that interpreting cPLI results for pancreatitis should always be done in conjunction with the dog's clinical signs. The researchers acknowledged some limitations to their study. The requirement for dogs to eat at least 50% of their resting energy needs might have led to the inclusion of dogs with less severe disease. Also, the study did not require a definitive diagnosis for enrollment, which prevented correlations between specific diseases and the observed changes. However, the inclusion criteria were designed to reflect the typical clinical scenarios where these tests are ordered. The large number of cPLI results below the detection limit also limited the conclusions for this analyte, and further research in dogs with confirmed pancreatitis would be valuable. The size range of the included dogs was also a factor due to blood volume requirements, potentially missing breed or size-related differences. Finally, the use of fixed equivalence margins rather than percentage-based margins could have influenced the statistical findings, but the researchers chose conservative margins based on clinical experience. In conclusion, this study provides valuable insights into the effect of feeding on serum concentrations of key gastrointestinal and pancreatic biomarkers in dogs with chronic gastrointestinal disease. While statistical equivalence to fasted values was demonstrated for cobalamin and cTLI at 2 and 4 hours post-feeding, and for folate at 2 hours, the study highlights that in a significant number of individual dogs, the clinical interpretation of cobalamin and folate levels can change after feeding. Therefore, the authors prudently suggest that withholding food before collecting blood samples for these analytes remains the most reliable approach to avoid potentially misleading results and ensure accurate clinical interpretation in this patient population. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.